Hi, my name is Dr. Mike Kempston, and I am a local orthopedic surgeon. I specialize in hand and shoulder surgery. I'm part of a team that includes physiotherapists and sports medicine physicians that help people improve their shoulder mobility and strength. This team is really important because most shoulders do not require surgery. We only recommend it after folks have attempted all other options like physiotherapy. There can be a long wait time to see a surgeon, and it can be frustrating to hear that you do not need surgery or that you need to complete a home exercise program first. Even if you do require surgery, getting your shoulder as strong as possible now will give you the best chance at having a really good outcome after surgery. Getting your shoulder safely in motion is the best way to start improving joint health. Shoulder injuries are often very painful and require 3 to 6 months of exercise. Progress can be slow. Don't get discouraged. If you watched our other video with Dr. Ure and Dr. Vale, you know that motion is lotion, and exercise will help to gradually reduce pain over time. You also know that there are over-the-counter medications to help with managing pain while starting to move. You can find the other videos on the East Kootenay Division of Family Practice YouTube channel. I want to emphasize that most shoulder injuries, even full-thickness tears, will improve with time and the right exercises. Just because it is torn doesn't mean it needs to be fixed by surgery. I have asked therapists at Kootenay Therapy Center to demonstrate key shoulder exercises. This is a great place to start, and I recommend these exercises often. Remember to stick with it.
This exercise is the pendulum swing. You're going to find a stable surface you can put the opposite arm on, keeping our back nice and flat, forward hinge. First pattern we're going to go is back and forth, swinging the arm nice and loose, 20 to 30 seconds for 2 to 3 rounds. The next pattern we're going to go is side to side, keeping the arm nice and loose again, 20 to 30 seconds for 2 to 3 rounds. The last pattern we're going to go into a circle, once again 20 to 30 seconds, 2 to 3 rounds, and then just opposite direction. Prioritizing the affected arm, and then you can switch. This exercise is for range of motion of the external rotation of the shoulder. First, we're grabbing a stick, shoulders are down and back. Moving the affected arm, you're going to use the opposite arm to push into that external rotation. Keeping that shoulder nice and relaxed, and arm stays close into the body. We're going to do that for 8 to 12 reps for 2 to 3 rounds. This is an exercise for range of motion for shoulder abduction. First, we're going to grab a stick. Using the affected arm nice and loose, the opposite arm is going to push the shoulder up nice and slow into that shoulder abduction. Working through a comfortable range of motion, we're going to do this for 8 to 12 reps for 2 to 3 rounds. This is the crossover arm stretch. Having our shoulders down and back, taking the affected arm across nice and straight, hooking it with the opposite arm, and holding for 30 seconds. We're then going to relax the arm back down, reset for 30 more seconds. Repeat this pattern for 4 rounds. This exercise is the isometric shoulder external rotation. First, you're going to find a stable surface like a wall or a door frame. Bringing our arm up to 90 degrees. We're going to externally rotate our arm into that surface, holding for 10 to 20 seconds, and then releasing. You're going to repeat that for 2 to 3 rounds. This is the isometric shoulder flexion. You're going to find a stable surface like a wall or a door frame. We're going to bring our arm up to 90 degrees, and we're going to apply pressure towards that surface. We're going to hold on for 10 to 20 seconds for 2 to 3 rounds. For some shoulder exercises, resistance bands are needed. You can get light, medium, and a little bit heavier. Tying the band onto something stable, you can use a door frame or a banister, tying it nice and tight so that it doesn't snap back at you. You can get these bands at a local physiotherapy clinic. This exercise is a banded external rotation. First, we're going to tie our band at belly button height. Next, we're going to bring our affected shoulder to 90 degrees. We're going to bring that shoulder into external rotation. The closer you stand towards the anchor, the less tension you'll have on the band. We're going to do this motion for 8 to 12 reps for 2 to 3 rounds. This exercise is the banded internal rotation. First, you're going to tie a band to about belly button height. We're going to grab the band with the affected arm, keeping the elbow at 90 degrees. We're going to pull the band in towards the body, keeping that elbow nice and close. We're working through this for 8 to 12 reps for 2 to 3 rounds. This exercise is the banded row. First, you're going to start with tying your band onto an anchor, grabbing onto 2 handles. Next, we're going to start with our arms nice and straight, squeezing the arms nice and close to the body, activating through the shoulder blades. Working through this exercise for 8 to 12 reps for 2 to 3 rounds. This exercise is shoulder ABCs. First, you're going to start with a soft ball, finding some spot on the wall here. Arm extends out at shoulder height, keeping that elbow nice and straight. We're going to work our way through the ABCs, putting light pressure through the ball, working your way all the way through the ABC, and you're going to repeat 2 times. This exercise is the scapular retraction. First, we're going to extend our arms out, relax the shoulders down and back, squeezing the shoulder blades together and holding for 5 seconds. We will then relax the shoulders for 5 seconds, and we're repeating for 8 to 12 reps for 2 to 3 rounds. This exercise is the prone scapular retraction. We're going to lay in a prone position, forehead resting on the towel, keeping our spine nice and neutral. Arms are going to extend out, squeezing the shoulder blades together and relaxing. This is what it'll look like. We're going to repeat that exercise 8 to 12 times for 2 to 3 rounds. This exercise is the side-laying external rotation. First, we're going to grab a weight, making sure our neck is supported by a pillow, bringing our elbow up to 90 degrees, making sure our shoulders are stacked on top of each other. We're going to bring that weight up into that external rotation, making sure that arm stays close to the body. We're going to work through this exercise for 8 to 12 reps for 2 to 3 rounds. This exercise is the single arm press. First, we're going to lay down on our back, having a small weight beside us, bending our knees, keeping that pelvis nice and neutral. Arm extends out, bringing that weight nice and close to the body and pushing it back up. Working through this exercise nice and slow, 8 to 12 reps for 2 to 3 rounds. For an added challenge, we're going to extend the arm up, lift the shoulder blade off the ground, and slowly return back to start. Once again, repeating for 8 to 12 reps for 2 to 3 rounds. This exercise is the scapular push-up. First, we're going to bring ourselves into that diagonal plank position, shoulders over top of our palms. We're going to bring our shoulder blades together and then push them apart, making sure that we are keeping those arms nice and straight. For that added challenge, bring yourself into a full plank, back into that shoulder retraction and pushing apart. Working through that exercise for 8 to 12 reps for 2 to 3 rounds.